Hey everyone, welcome back to week 4 of our video Q&A, but week 3 of coronavirus.
Yes, we look a little bit different today. As the coronavirus pandemic advances and as we learn more, we now are learning that actually people wearing masks in daily life may actually help prevent the transmission of the virus. So that's why we're dressed this way right now.
And we still want to maintain our distance 6 feet apart. Unfortunately, we cannot do 6 feet apart in this video. So although we are breaking the rules in the video, we are wearing masks to show how important that can be. But at all other times, we are recommending 6 feet apart social distancing from one another.
Exactly.
We've had a lot of questions from our pregnant patients or people hoping to get pregnant, coming close to going into labor, wondering what is life like in the era of coronavirus as a pregnant woman. So today we thought we would answer some Q&As with regards to being pregnant during coronavirus.
Coronavirus has affected patients of all backgrounds. We've talked just in general terms about coronavirus, but got some resident experts in women's care, especially pregnant women's care, and so we want to ask some questions. So you know Super J or Jackie is super midwife. So Jackie, what is a midwife?
So excellent question. A midwife is a nurse who has gone back to school to achieve her master's degree in nursing, specifically in certified nurse midwifery school. So I'm kind of like a women's health nurse practitioner that can also deliver babies. So I can see you in the office for all of your gynecological needs, but I also can attend your birth and help you deliver your baby in a hospital setting.
Excellent. So Jackie, at Women's Healthcare of Illinois, we have midwives and also doctors, OBGYNs. So what would be some of the reasons a patient would choose to see a nurse midwife as opposed to seeing a doctor?
So in our practice, yes, we have 4 midwives and 4 doctors, and we work in collaboration with each other. Midwives take care of low-risk patients. So a lot of patients will seek us out if they are looking for a natural birth, but they can also seek our care if they're not planning for a natural birth. Contrary to popular belief, most midwives in this country deliver patients in a hospital setting, not at home, which, not that we're knocking home midwives either, but we do deliver in a hospital in collaboration with our physicians, and we do provide a lot more support in labor to our patients. So when the patient shows up in labor, we also like to meet our patient at the hospital and spend the entire labor with the patient, supporting them until they have their baby.
Nice. So Jackie, that sounds great, but are you legit? Like, I mean, you said a nurse. That sounds maybe not as prominent or appealing. And so what about people that say, I'm having a nurse deliver my baby?
Right, so yeah, you're right. Our title is a certified nurse midwife, but we have passed a national certification and we are licensed to practice in the state that we're in. So I am a licensed board certified nurse midwife for the state of Illinois.
That sounds more official.
Yes, very official.
So we've been focused on coronavirus the last few weeks, but anyone can actually do a video visit. We can see you for a video visit if you're a patient of ours and you have a quick concern, if you have a sore throat, if you have joint pain, if you have a rash, if you have some pregnancy-related questions.
If you have a UTI.
These are all opportunities to use the video visit as opposed to coming into the office.
And also, we're seeing any and all patients for our video visits. A lot of offices are closed, and we remain open, and we definitely remain open in video visits via telehealth. So anybody and everybody that's looking to get any health care, if they don't want to come to the office but are not really sure what to do, whether they should come to an office or call in, they can definitely call our office for family medicine or OBGYN and schedule a video visit. We have an exciting special guest today, don't we?
We do, yes, Beth Smith.
Yes, she is our head midwife
Welcome
Hello.
back.
It happens to also be her birthday week this week.
Happy birthday, Beth.
Thank
I'm sure
you,
you had
thank you.
a huge party, right?
Oh, properly socially distanced, but I did have some really great friends who shared some great birthday gifts. What do you get a nurse during a pandemic? PPE!
Nice.
Thank you!
So we brought Beth here today to ask her what life is like for a pregnant woman during the coronavirus pandemic. What are things that our pregnant patients can expect from hospitals, from the office, things like that?
Well, pregnancy is definitely a time that many women are pretty worried about this coronavirus. We're getting asked a lot of different questions from moms. They are worried about what changes are happening. And we have definitely made some modifications to the pregnancy prenatal schedule. We are only bringing patients here into the office during the time that they actually need to either have lab work done or an ultrasound with their prenatal visit. Otherwise, we're trying to use telehealth, and telehealth is really new when it comes to prenatal care.
Great. So Beth, if you have a pregnant patient, should she still come into the office? Is it okay? Is it safe for her to come into the office?
It's definitely safe for her to come into the office.
Okay.
We have made really good efforts in our office to limit who is coming in. We only have patients that we know are healthy coming in. The rooms are properly sanitized and extra time is taken in between each patient. We're wearing masks. We ask, though, if you are not feeling well, that you let the desk know that before you come in and remain in your car, and we will get you scheduled for screening if you are not feeling well or you have symptoms of coronavirus.
Okay.
And we have done that before. We're more than happy to see you for your entire OB visit in your car. We can listen to the baby's heartbeat, take your blood pressure, even give you the little dipsticks for your urine to your car.
Yes, we have definitely made lots of screening changes because we want our patients to be as comfortable as they possibly can be and get the care that they need.
Great.
Some people have already planned to have a doula at their birth, and we have a few doulas working with us for patients that maybe did not plan for a doula at their birth, but things have changed and they want some more support in labor. So we have some doulas working with us that are willing to support a patient at a discounted rate even, which is really great. A lot of people don't know what a doula is, so Beth, can you let us know?
So a doula is somebody who is trained and certified in labor support techniques. They often meet with clients for months ahead of time, do some of their childbirth education, kind of help families prepare for the actual childbirth experience. Doulas don't mean that you're giving birth in an unmedicated environment only. They can support moms who are having epidurals and stuff too. They also are support for the significant other who is there during the time of labor, because it's stressful for everybody to be there.
Speaking of prenatal classes, a lot of classes are not getting together right now, but there are a lot of virtual prenatal classes.
And we have really worked with some of our great teachers. They are moving all of those modules online for us. So make sure that you're following our Facebook page and our website, because you'll start to see those come up. Some of our doulas and our educators are offering both a group class for all of our patients as well as individualized Zoom classes, so they can focus on a variety of different things. We have nutrition classes that are coming up that way, breastfeeding classes. We have visits coming up that do our Your Birth Your Way class, minding your own birth. There's a lot of different options out there. So make sure that you're following along and getting connected with that. It's something to do when you're sitting around instead of just watching TV too.
And when you're not able to have as much support as you were before, especially now, but at all times we definitely encourage that people take some prenatal classes before they go into labor. We've had a few patients ask us if home birth is a safer option than going to the hospital at this point. What are we telling those patients?
So we are strictly a hospital-based group. We are not providing home births. We have not started providing home births during this time. The hospital is still a safe environment. Again, we are limiting patients that are sick from being on a general labor and delivery ward.
So So let's say the pregnancy, it's going well, that happy day comes where a pregnant woman goes into labor.
Happy, but maybe a little painful.
Happy for the father from experience. Yeah.
Terrifying.
But so a lot of times, there've been labors where partner is there, grandma's there, friend is there, a doula is there. It's this whole party. There's 6-7 people there. What is the protocol now in the era of coronavirus?
Well, it definitely has changed it. It is not quite the same birthday party that it once was. You'll come in, you'll be asked some screening questions before you even get past the lobby. So will your partner, and they will go ahead and actually check your temperature before you're even brought upstairs to the maternity units.
Okay.
At that point in time, most hospitals are only allowing one visitor. That person is usually your designated support person. However, if you do have a doula that you've contracted, or you are one of the midwives, we do not count as your visitor, and you still get to have that family member with you. So in those cases, there are some extra support people around. And some of the doulas are even doing virtual douling, where they're not present in the room, but they're present on an iPhone or through a Zoom chat, and actually helping moms in labor that way.
They can't actually massage though through the virtual.
No, but they can do some good teaching with the
Dr. B
husbands
with the
ahead of
jokes.
time.
Some women are worried about being separated from their baby once they deliver. Can you shed some light on that? Explain that scenario to us a little bit more.
Sure. So that's not happening much in our area whatsoever. There are some recommendations that the CDC has put out that if a mom is positive for COVID-19, that if she tests positive and she's pretty sick, that she probably might want to be separated from her baby for that 14-day period. Now, that doesn't mean that there's no contact with the baby. It just means that there's limited contact so that she has time to rest and recuperate and take care of herself. But it's suggested that you continue to breastfeed, that you're wearing your mask during those feedings. Breast milk is not being shown at this point in time to aid in the transmission of the virus. So we really are encouraging moms to continue to pump or to breastfeed their babies.
Right, there is no official evidence of vertical transmission from the mom to the baby. In a study done in Wuhan, it showed that I think out of 6 moms, maybe 1 baby transmitted the virus, but it was unclear whether the baby had transmitted it after it was born or...
In fact, we were talking about this earlier. If you're pregnant and you get coronavirus, you get COVID-19, they've actually detected antibodies in the infants after they've delivered. So the maternal antibodies are passed on to their infants. So even though to have coronavirus while you're pregnant would be scary and anxiety provoking, in a way that is going to protect the infant when the infant is born.
Right, because those infants were born and tested negative for coronavirus, but were found to be positive for antibodies, meaning that their mom passed on immunity to them,
Exactly.
even though they tested negative for it.
And typically, even the amniotic fluid that's been screened for moms who have positive, we haven't seen that there are actually coronavirus present in the amniotic fluid either. So again, no vertical transmission to the babies.
Dr. Beckman, as a pediatrician, what would your recommendation be in terms of separating mom from baby or the risk to the infant if, let's say, mom goes home and then becomes positive for coronavirus at home? What is the risk to her infant or even her young children?
So early on in the outbreak, the thought was that infants and young children were immune, that they weren't getting infected, but unfortunately there have been a couple of infants that have died with the coronavirus. So there still is a risk of transmission. And as Beth was saying, if you're a mom and you don't have any other support network, then you have to take precautions, the usual precautions of hand washing, wearing a mask when you're feeding. But if you do have a support system, then trying to have someone else feed the infant, you can still breastfeed, but that would be pumping and having a partner or a grandparent feed the infant, at least until you become asymptomatic. And at that point, then the risk of transmitting that infection is a lot lower.
What do you think about early discharge for these moms and babies?
So I think that it makes sense to discharge them early, assuming that everything is stable. We would want to see that infant in the office because we want to make sure that they're feeding well, they're gaining weight. We want to make sure that they're not having any issues with bilirubin. So again, our offices are clean. We're not bringing any sick patients in. And anytime myself or anyone else from Family First Medical Group is examining an infant, we're wearing a mask and we're wearing gloves just as an extra precaution.
If you are having concerns about the hospital, I really encourage you to have a conversation with one of us. We have taken some big steps this week. We now have a little Facebook group for our moms-to-be and our new moms, and you can find links to that from our page. That's a good place to kind of talk about some of your fears and your anxieties. There's going to be some really good support articles up there. There'll be some guided meditations and relaxation techniques up there and other things along those lines.
We had talked about early discharge of infants so that we could see them in the office in a safer environment. But that's mainly to make sure that feeding is going well and the infant is doing well immediately after delivery. But once we see that infant and things are going well, we can spread out those visits and we can actually do some video visits. Obviously, it's a lot harder to examine an infant on a video, but we've had some moms that have that show us their breathing, show us their face, their movement, and we can get a good idea of how the infant is doing at home. We've had some parents decide to postpone some of the vaccines until things get a little bit better, which I think as long as you're sheltering at home and as long as you're not going out and getting exposed to a lot of other people is okay to do. I think you want to lower the risk of any type of transmission or infection.
And same for our OB postpartum visits. Some of our OB visits, but definitely our postpartum and breastfeeding support visits, we have done video visits for. So our 2-week postpartum visit.
And those moms who are having breastfeeding issues, if you're having an issue with an oversupply or a mastitis or a clogged duct, those are visits we can actually do through the video. We can also do some feeding visits just to make sure you're getting proper latch and things along those lines, as well as that 10-day to 2-week postpartum visit.
Yeah, so definitely don't hesitate to reach out. Just because you want to stay out of the office or you're afraid to come to the office doesn't mean that we can't talk to you via video visit.
And the same thing if you're finding that you're overwhelmed, being home and isolated from your family with a newborn, you're anxious, you're starting to have some signs and symptoms of postpartum depression. Those are also things that we can go over, and we have lots of resources and ways to deal with. So please reach out to us and we can definitely do a video
Chat us
visit
up
for that.
Wash your hands. Don't forget to wash your hands.
Don't touch your face.
All the crevices.
Wash. Thank you. Oh, pass the sanitizer.
Pass the
There
And
you go.
just remember, friendly reminder, we all know how to wash our hands, take our masks off properly. We never touch the front of our mask. We only touch the side of the mask.
We wear our mask over our nose and our mouth.
Right?
Not
below
below.
the nose.
Right?
Mm-hmm.